Hi, I'm Caitlin Williams. I have 3 years of experience as an RBT in a clinical setting.
Hi, my name is Morgan O'Donnell. I am a behavior specialist with 3+ years of experience.
Hi, I'm Ashley Overeem. I am a special education teacher. I've been teaching for over 10 years, the last 4 years in the multiply disabled room, working specifically with children with autism.
My name is Rachel Ippolito. I have been working in the ABA field for about 3.5 years now as a behavior technician in a clinical and home setting.
Hi, I'm Caitlin. So for our presentation, we will be illustrating the pros and cons of how telehealth ABA services potentially threaten the future through an informal debate-style presentation. So a little bit about just telehealth in general. So telehealth is defined as the delivery and facilitation of health and health-related services, including medical care, provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. So this can include things like Zoom meetings or Teams meetings, things like that. The methods of telehealth are live video conferencing, like I said, mobile health apps, store and forward electronic transmission, and remote patient monitoring. Telehealth has been used for almost 2 decades in delivering ABA services. So currently the BACB does not have any specific ethics codes that address telehealth, although there are a lot of different ones that kind of relate to telehealth, which we will get into a little bit later.
The following slides will argue in favor of telehealth. Telehealth has a number of benefits, including, but not limited to, increasing access to services, providing a means of collaboration with both stakeholders and professionals, as well as allowing for low-cost, effective, and socially valid treatment delivery. Graphs and visuals will be presented in tandem with research pertaining to for telehealth. The following slide will introduce the research backing for the pro-telehealth side of the argument. Patel et al. 2021 mentions that telehealth provides flexible supervision opportunities to assess competencies. This flexible supervision modality can be utilized by behavior analysts to assess and observe the behaviors of stakeholders, such as learners and parents, as well as other professionals, such as technicians and supervisees. Observing intervention by stakeholders and professionals is an important component of ensuring effective treatment regardless of the modality of supervision. Behavior analysts should conduct constant monitoring of implementation to assess progress and treatment fidelity, even if this means doing so through telehealth technology. Patel et al. 2021 also reports that telehealth differs from in vivo supervision in both the content delivery and training modality, in that it is often more goal-oriented and direct than in-person supervision. Beginning with collaboration with stakeholders. Stakeholders such as the parents of the learners we service, as well as the learners themselves, can utilize telehealth for parent training, measuring treatment fidelity, and observing behaviors in settings otherwise inaccessible. First, we have parent training. Behavior analysts should regularly collaborate with stakeholders, specifically parents of learners. Communication facilitates rapport, satisfaction with treatment, as well as quality of supervision and treatment, as reported by Pollard et al. 2017. This ethical obligation largely relates to Code 2.09 involving clients and stakeholders. Telehealth provides a flexible modality to involve stakeholders that may better work with their work schedule and accommodate barriers to treatment such as transportation. One family we work with at my company requires telehealth parent training due to her busy work schedule. Without this option, she would have to go without parent training, which would pose a limitation to the quality of her child's treatment. Next, we have supervising parents implement treatment. A parent or other stakeholder could be observed implementing the treatment within generalized contexts, allowing the analyst to measure generalization of skill acquisition and behavior reduction. In addition, observing parents or other stakeholders implement treatment would allow behavior analysts to measure treatment fidelity. This is of particular importance if there are reports of behavior not generalizing or moving in the correct direction. For example, if a skill goal was moving down or if a behavior reduction was increasing. Assessing the fidelity of treatment would allow the analyst to determine if parents are properly implementing the behavior intervention plan according to protocol or determine factors impeding treatment. Observation through telehealth can be used to identify goals for improvement similar to how they would be identified in vivo. Lastly, we have observing in home. Telehealth can also allow analysts to observe behaviors in environments they may not have access to otherwise. For example, if a behavior is only being demonstrated at home, such as aggressing towards a sibling, but the child is receiving services in a clinic that the sibling does not attend, telehealth could allow the analyst to see that behavior. We can't treat behaviors that we don't see because behavior is based in observation. Data can be taken through telehealth to inform treatment the same that it would be in person. Next, we have collaboration with professionals, which begins with supervising technicians. Analysts are required to supervise technicians to ensure they are performing their job with competence. Ensuring competence is one of the core principles of the ethics code for behavior analysts that kind of encompasses all things that we do. Telehealth can be utilized to conduct treatment fidelity measures such as teacher performance rating and accuracy scales. For example, we have an analyst that telehealths in to observe our technicians specifically for treatment fidelity, and she performs these TPRAs where she looks at the materials and the setup of the program, the delivery of the antecedent, the observation of the behavior and IOA data collection itself, as well as the provision of a correction or reinforcement following that. So that just kind of helps to see, like, is this program being run as it was supposed to, or is there something that needs to be fixed in the program? Is it readable? All those sorts of things. Next, we have supervising trainees. Trainees accruing fieldwork experience hours can receive supervision through telehealth. I have personally received a majority of my supervision this way from experienced behavior analysts to acquire my supervised fieldwork experience hours. I actually am done with my fieldwork experience hours now because of being able to gain it through telehealth. I found this method of training to be extremely beneficial, particularly when my previous supervisor had to go on medical leave. The flexibility of telehealth allowed continuity of my supervision experience without a pause in my learning, despite one of my new supervisors living in a completely different city than me. We utilized the typical BST model, behavior skills training, in which we worked in tandem with learners on similar goals so that I could apply the skills I was learning directly. Having the support of a supervisor available through telehealth built my competence and confidence as a trainee, and I feel I am more than competent at providing service delivery for our learners. See the following slide for more information on supervision of trainees and some visuals of that. Third, we have professional development. the use of telehealth technology also allows for access to new strategies and research, furthering continued education and the development of our field as a whole that may have been otherwise inaccessible. This is in Pollard et al. 2017. Professionals in the field of behavior analysis can access conferences and presentations that they may not have been able to attend in person. In this way, the use of telehealth can help behavior analysts in their ethical obligation to maintain competence as it's related to Code 1.06. Finally, we have team meetings. Team meetings can also be conducted via telehealth, which can help kind of facilitate communication across service providers and stakeholders, ensuring quality and consistent service delivery. Despite differences in training modality, Tarlow et al. 2020 found that supervision via telehealth is an effective alternative to in vivo supervision in regard to both satisfaction of supervision and working alliance. Working alliance has to do with the rapport between the supervisee and the supervisor, as well as client focus, which is the supervisee's understanding of the client and their treatment. Using a multiple baseline, single case experimental design, the research team demonstrated the following results. In Figure 1, we can see that supervisees had similar levels of satisfaction during both in-person and telehealth supervision, which just shows that they were still satisfied on the treatment, whether it was either modality. In Figure 2, we can see that in comparing the supervisory alliance between telehealth and in vivo supervision, we had equivalent results, showing that rapport maintained the same level as did client focus, regardless of the modality of supervision. This data by Tarlow et al. 2020 supports previous findings in that supervision provided via telehealth does not decrease satisfaction or rapport between supervisor and supervisee and does not compromise the learning experience. There were minimal differences reported between these supervision modalities.
Continuing on from the previous slides, there are other positives to using telehealth. With using telehealth, there is an increase to anyone seeking access to ABA services. Over the last couple of years, there has been a shortage of ABA service providers. This has been quite a dilemma because there are many individuals that are seeking services for ABA that may not be able to get access to meeting with a BCBA, RBT, or etc. in their community. With there being an increase in individuals diagnosed with ASD, there needs to be a solution to providing these services. Having the option of distance or remote learning, this can assist with providing services to these individuals with ASD so that it can ensure they are getting the assistance and ABA services that they want. This goes hand in hand with increasing access in rural communities as well. Individuals in a rural community do not have the access like some more populated areas to ABA services. Telehealth provides a way for these individuals to remotely learn without having to travel a long distance or when they have services nearby them. According to Weiner and Ingersoll, telehealth and related technology-based applications have potential to replace or at the very least augment traditional service models to increase access to evidence-based services from a distance. There are also many other benefits to telehealth. The first factor that makes telehealth a better choice is that it is cost-effective. There have been increasing evidence to suggest that telehealth programs can reduce patient and provider costs and increase provider system coverage relative to traditional in-person service delivery models. Being cost-effective also reduces the amount of finances and time that one family or individual goes through when traveling a long distance and taking some time off of work to get ABA services. Telehealth also works with being socially valid. In a service by Ferguson et al. 2022, results of a social validity measure found high acceptability of the telehealth service delivery modality, materials, and platform, and reported satisfaction with changes in behavior. With it being effective for parents, the use of parent training can further allow for socially validated behavior change to occur in relevant environments. Telehealth is a way for these parents to work hands-on with their child in order to implement the most effective treatment possible with the assistance of remote learning. This way, it can be used in a home setting. The visuals provided below show some insight into how effective telehealth is for teaching and training parents with their child at home. These are from a study by Weiner and Ingersoll that goes over how effective each stage in the telehealth program was for the parent who implemented this program with their child. There was 5 families that were used in the study with children 24 to 72 months old. The parents and children went through stages of the telehealth program, which included baseline phase, treatment phase with self-directed condition and coaching condition, and the follow-up phase. These stages included baseline probes, RIT knowledge quizzes, 30-minute coaching sessions, and 1 to 2 month follow-ups from after the study. In the first graph, the fidelity was measured between all parents through each stage of the study. The results showed that there was a significant increase of fidelity from the treatment phases. In the baseline phase, the parents showed low ratings of fidelity. With the use of telehealth program, the parents gained great insight in how to implement the RIT practice and techniques with their child during sessions at home. The second graph that we see shows the children spontaneous imitation rate. The rates during the baseline phase were really low to start. There is no significant increase like the parents' graph, but the child does show a slight increase during the coaching stage of the study. In the end, the study showed that when the parent goes through each stage of telehealth program with their child and stays consistent with it, they can achieve fidelity within each stage of the process. Here we are moving on to the ethics codes of ABA. The codes below are all being provided by the use of telehealth. The first one is 1.7, Cultural Responsiveness and Diversity, which is behavior analysts engage in professional development activities to acquire knowledge and skills related to cultural responsiveness and diversity. The next one is 2.1, Providing Effective Treatment, which is behavior analysts prioritize clients' rights and needs in service delivery. The next one is 2.10, Collaborating with Colleagues. Behavior analysts collaborate from their own and other professions in the best interests of clients and stakeholders. Next, 4.6, Providing Supervision and Training. Behavior analysts deliver supervision and training in compliance with applicable requirements. And the last one is 4.8, Performance Monitoring and Feedback, which is behavior analysts engage in and document ongoing evidence-based data collection and performance monitoring of supervisees or trainees. To summarize the pro side of telehealth, it is very valid that telehealth has been super beneficial for all families and individuals with ASD. The service that telehealth provides ensures that these individuals can get ABA services in a way that is cost effective, socially valid, and effective for the parents and the child in an at home service. Even though the service is not in person, telehealth assists with having collaboration between professionals and stakeholders by providing remote training like parent trainings and etc. With the increase of individuals diagnosed with ASD, telehealth has become a very effective way to get access to these ABA services.
So, some of the cons of telehealth include that delivering therapy this way is a very cut and dry way rather than forming real life connections with clients in person. Access to these services require many different resources that all families may not have a way of obtaining, which overall decreases the amount of clients that are receiving these necessary services. There is also a huge risk of loss of confidentiality for these clients during a telehealth model. So, some of the research backing our stance against telehealth includes a lack of therapeutically beneficial environment. So, these telehealth manuals should include detailed protocols on assessing and creating the most beneficial environment, including designing a location for technology to allow optimal camera view of the session, environmental safety inspection, and a plan to identify potential safety concerns, especially for clients with self injurious behaviors or aggression. Therapeutic materials inventory to determine families' in home resources, which in turn would optimize the treatment environment. There's also a problem with eligibility for telehealth services. So this could depend on age, the severity of behaviors, the level of support they receive from caregivers, which is not always great for every client, unfortunately. So just kind of a continuation of that research. So there are a lot of technical resources required for telehealth services. So this can include a stable internet connection, a video camera, a computer or a laptop, microphones, all of that. So that is not always affordable or realistic for every client and their family, especially in rural areas where telehealth aims to serve, where in-person services might not be available. There is also a huge risk of confidentiality and loss of privacy through telehealth. They are more at risk for these through the telehealth model due to the fact that computers could be hacked or data could be breached, all of that. So that is another point that we have made against telehealth.
To continue on with the cons of telehealth, we need to look at how the telehealth limits supervision. Pollard et al. Said that telehealth supervision limits the ability to use modeling strategies to teach new skills. That means that demonstrating any new strategies or coach the parents, it makes it very difficult. And it also, by doing using utilizing telehealth, you're also limited in the treatment options that you can provide for your clients. In addition to, there are caregiver complications. Some caregivers may have challenges in learning and using telehealth devices, or have a negative feeling about telehealth. Um, and so there then becomes privacy concerns representative of the common negative effect of using telehealth for caregivers. But also, within caregiver complications, there's also the possibility of distractions for the client, and competing demands from the caregivers versus the technician, um, and also the expectations and perceptions of services are could be different, given what the caregiver is seeing or observing, and how they feel that their child may be participating, especially if we, as the BCBA, have never met the client before. The parents might have, or caregivers may have, other um, thoughts and feelings, and a different way of expectation for their child. Um, and as I said, demonstrating the strategies, or even coaching the parents to show them the ways in which they can utilize some of the strategies that you are working with the client on. It becomes very difficult to do in a telehealth situation. You are not able to hands on work with the parents. Um, in addition to caregiver complications, there's also child engagement complications. Um, there are clients who may have difficulty maintaining attention, elopement from the session if you have behaviors that are um, such as elopement, that makes it very difficult to have a successful telehealth session and be able to apply treatment to the client if they are eloping from the session, because you are not able to be there physically with them. And then you are then relying on the caregiver to be present and be active in assisting to make sure that the client is back in front of the telehealth, and being able to work with you. In addition to the age of the client, if the client is really young, it's going to be very difficult. And if there's a language barrier between you and the client, that also makes it telehealth makes it very difficult to be able uh, to even assess a client. Um, and if a client has not experienced telehealth before, that's also a new challenge. Um, Besides just the caregiver complications and the child complications, or the client complications, there's also your technical difficulties. Minatondi et al. Said that barriers related to malfunctioning equipment or trouble with internet connections, forgetfulness, and feeling poorly. So, if you're set up and ready to go to a telehealth session with a client and their internet goes out, then you're not able to easily connect with them. So then, um, in most cases, you may need to postpone that session. So then the client is not getting active treatment, and the services that they require, to meet what their minimum requirements are hourly for the week. In addition, that also affects you, because your equipment can also, as the BCBA or the technician, the equipment can go out, and if we are relying on our computers to have and hold the um, documentation to for the client, um, these difficulties can make it hard to keep the code of ethics.
So although the BACB ethics code does not directly relate to telehealth, there are some ethics codes that still apply. So the first one is Ethics Code 201. It's providing effective treatment. This one says that behavior analysts prioritize clients' rights and needs in service delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes for and to protect all clients, stakeholders, supervisees, trainees, and research participants from harm. Behavior analysts implement non-behavioral services with clients only if they have the required education, formal training, and professional credentials to deliver such services. So that next one is Ethics Code 2.02, which is timeliness. This one is the behavior analysts deliver services and carry out necessary service-related administrative responsibilities in a timely manner. So this could include setting up appointments through telehealth, all of that. And that next ethics code is 203. It is protecting confidential information. This one is super important when it comes to telehealth services. Behavior analysts take appropriate steps to protect the confidentiality of clients, stakeholders, supervisees, trainees, and research participants. They prevent the accidental or inadvertent sharing of confidential information and comply with applicable. The scope of confidentiality includes service delivery, which is live telehealth services, recording sessions, documentation and data, and verbal, written or electronic communication. So through telehealth, these are directly affected, and it is super important to protect client information.
According to a recent study done on telehealth and its barriers, Pomalo Ramos et al. Created a study where they identified client barriers as well as administrative barriers to telehealth. And in these two pictures, they are broken down. One side is administrative barriers, which include but are not limited to access to research about telehealth services, being able to complete intakes on new clients, as well as access to therapy or assessment materials for the clients. And on the client side, then we see the barriers that include clients who have more challenging behaviors, such as eloping or bolting, and the effectiveness in being able to address those behaviors well on telehealth, as well as um, relying is giving to telehealth to clients who are in the early stages of services, as well as those who might experience motor difficulties, um, and providing telehealth to clients who communicate with using single words. It makes it very difficult over a telehealth visit. To recap the research backing the negative influence that telehealth has, specifically on ABA and providing services to clients, we addressed the lack of a therapeutically beneficial environment, the eligibility for telehealth services, along with the technical resources that are required both for the administrator or the BCBA BT and the client themselves, as well as the risk of confidentiality and loss of privacy that occurs through telehealth, limits of telehealth supervision for the client, as well as caregiver complications and child complications, client complications, as well as technical difficulties, which presents one of the biggest risks, especially because it is not always known ahead of time that this may happen. Not to mention also the ethical codes that are broken with or
are difficult to abide by with telehealth services?
To conclude this whole debate, both the pros and the cons side of telehealth have made a very strong argument into why telehealth is or isn't effective for families and individuals with ASD. Everyone has their opinions on if telehealth follows the ethics codes of ABA or goes against it. It depends on the way that certain individuals portray telehealth based on effectiveness, collaboration between individuals, responsiveness, and etc. Many other ways. Telehealth, which is a way to provide healthcare via remote telecommunications, with the technology we have also nowadays, has been a naturalistic way of teaching these services. There are individuals that may like more a hands-on approach to ABA in a clinic, but there's also individuals that want a low-cost service that can be used right in their homes. This is all why telehealth has made such an impact on ABA services for years now and will continue for the future as well.
All right, cool. All right, so question and answers time. So first question we have are the needs of all clients being met when they participate in telehealth?
Caitlin, do you want to start us off on this one?
Yeah, so to kind of go against that question in telehealth, I think that the needs of some clients are being met, but not all. I think this partially depends on like the severity of behaviors, the skills that client is working on, and kind of varies per client.
I also, just to add on to that, I think it also varies too. If you have a new client who's never used telehealth before, and the language barrier, those are also considerations on whether telehealth is going to be proved to be effective or not, and the support of the parents. Because if you don't have a caregiver that's there with the child, and they might have behaviors that are things like eloping, it's very hard to have a child come back to the telehealth session if there's not someone on the other side assisting.
I believe that a lot of the services are being met just because it is more also being like a cost-effective way for these individuals that are trying to get ABA services and may not be able to afford in-person clinic, or even being a long distance away from a clinic or just a BCBA in general, that these using telehealth can help with getting that direct training that the parent may need and the child may need as well.
And I think to add on that, for the pro telehealth side of the argument, considering not only just the clients but also the supervisees and technicians' needs regarding supervision, I think is easier to meet in telehealth sometimes.
Okay, well, moving along then, how does the provider provide the most effective session over telehealth?
You want to start?
Yeah, you can start, Morgan.
Yeah, I was just going to say that I don't think that much of the standards for providing services changes in regard to whether you're providing in vivo or telehealth services. You kind of have to uphold the code and all the ethics the same way regarding effective treatment, like evidence-based practices, your supervision model, and everything has to be pretty consistent.
Just to go off of what Morgan was saying, also this is a great way for the parents to even get more training with their child or the individual that has ASD, because if it's in a in clinic service, it may not be as easy for the parent to get training, and also if the parent gets training, they could provide those services without a BCBA around at home as well.
I think it's going to be difficult for a provider to provide telehealth services, especially because when you're assessing a client or you're taking notes or data, you're not able to see the whole environment around that client. So you really don't know and have an accurate representation of what is happening. So in order to create an effective treatment plan, it makes it very difficult being in a telehealth setting. To know what the full extent of what's going on in the environment is.
I would definitely agree with that, Ashley.
All right. And how can we ensure that all of the codes of ethics are being followed?
I kind of feel like, similar to the previous question, we have to uphold these codes in the same way as before. So, like Rachel mentioned, some of these parents we can give increased access to, which kind of does our ethics code 1.07, responding to cultural diversity factors, just providing effective treatment in general, collaborating with colleagues, all those good codes just need to be upheld the same way.
I think it's very difficult because, as I mentioned, we don't know what the surroundings environment is. So there's a lack of privacy and confidentiality on the part of the BCBA, not knowing what's going on in the client's home or who's there. So it makes it very difficult to be able to provide, to uphold the ethics codes. And also just even taking notes, as I said earlier, taking notes, and documenting all that you're seeing and that you're doing within the treatment plan makes it very difficult when you are in a telehealth setting, and so that goes against providing effective treatment. There's a lot of things you can't do via telehealth that you can do when you're in person.
And that is all for our debate on the pros and cons of telehealth in ABA. I hope you guys enjoyed it.